Hello, here I'm going to talk about the anatomy of auditory tube. It includes its parts, relations, blood supply and nerve supply. Here this is the frontal view of the right ear. The parts of the ear, this is the external ear. This part is the middle ear. See this is the inner ear. See the middle ear, the lateral wall. That is the tympanic membrane. The medial wall is made up of this lateral wall of this inner ear. The roof here is formed of this petrous part of this temporal bone. This is the temporal bone. This is the petrous part. Then in the anterior wall, there you can see opening for this auditory tube. It has a bony part and this is the cartilaginous part. So this auditory tube or this eustachian tube or the pharyngotympanic tube is a osseo-cartilaginous channel which connects this anterior wall of this tympanic cavity or this middle ear with this lateral wall of the nasopharynx. So here this auditory tube communicates this middle ear with this nasopharynx. Then the function of the auditory tube, it maintains an equilibrium of low air pressure on either side of the tympanic membrane, that is to the exterior with this interior. Then there's the parts of this auditory tube. This is the middle ear. See, this is the anterior wall where you can see the auditory tube. It's a bony part and cartilaginous part. The total length is 36 millimeter. In that, the bony part contributes of 12 millimeter and forms the lateral 1/3 of the auditory tube. The cartilaginous part length is 24 millimeter and forms the medial 2/3 of this auditory tube. Here, the junction between this bony and cartilaginous part is narrow and that part is called the isthmus. This auditory tube directs downwards, forwards and medially from this anterior wall of this tympanic cavity to this nasopharynx. Then the cartilaginous part is also same direction, downwards, forwards and medially through a groove on the undersurface of this base of the skull. That groove is called the sulcus tubae, that you can see on the base of the skull, the articulation between the greater wing of the sphenoid and the petrous part of the temporal bone. Here this is the base of the skull. Here this is the anterior part, this is the posterior, that you can see the foramen magnum of this occipital bone. Then this is the lateral, here this is the medial, this is one half. Here this is the greater wing of the sphenoid. This part is the petrous part of this temporal bone. This is the petrous part. So this cartilaginous part is lodged in a groove between this greater wing of the sphenoid and this petrous part here. Then it has this cartilaginous part, it has an apex which is attached to this bony head, this base which is towards the nasopharynx. Then it has a medial broader lamina and this lateral shorter lamina. These two lamina are continuous superiorly at the level of this base. This is the inferior view. It continues superiorly at the level of the base. Then inferiorly and laterally there is a gap between this medial and lateral lamina. That gap is filled by a fibrous membrane. So this cartilaginous part is also termed as a fibrocartilaginous part here, and this cartilage is of elastic type. Then it directs downwards, forwards and medially through this groove, then passes anteromedially to the nasopharynx. Then here this is a posterior view of the pharynx. This is a coronal section. Here this is the basilar part of the occipital bone. See the mandible, posterior view. This is the pharynx, posterior view. There you can see the muscles, circular muscles of the pharynx, superior, middle and inferior constrictors, outer. Into that you can see this the longitudinal muscles of the pharynx. See this the auditory tube here. Through the groove, downwards, forwards and medially through the groove, that is the sulcus tubae. Then through a gap there, that is called the sinus of Morgagni. So sinus of Morgagni is a gap between the base of the skull and the superior constrictor muscles. That gap is filled by here. There is a fascia there. This is the pharyngobasilar fascia, and also here the constrictors are lined by a fascia, that is the buccopharyngeal fascia. It pierces to fascia and through the sinus of Morgagni, then enters the lateral wall of this nasopharynx. Here, this is the sagittal view. This is the lateral wall of this nasal cavity. This is the superior, middle, and inferior concha. See here, this is the pharynx. This part is the nasopharynx. Here, this is the opening of this auditory tube or the eustachian tube. See, this opening lies 1.25 centimeter just behind and inferior, slightly inferior to this inferior nasal concha. Then this part of the opening, this is the widest part of this eustachian tube. Here there is an elevation. This is due to this cartilage that is called the torus tuberous, this part. Just behind this elevated part, there is a small elevation there. That is due to this tubal tonsil. So tubal tonsil is a collection of this lymphoid tissue there, okay, and also this elevation is called the tubal elevation. Tubal elevation. Here. So in the lateral wall of this nasopharynx, there you can see this is the opening of this eustachian tube. Then coming to this relations of this bony part, this is the medial wall of this middle ear or the tympanic cavity. This is the posterior, this is the anterior. So the anterior wall, there you can see the opening here, this for this auditory tube. Above that, there you can see there is a opening for this foramen for this tensor tympani muscle. See, this is the tensor tympani muscle. So the relations are: above there is the tensor tympani muscle, below the tensor tympani there is a bony projection towards this medial wall. That projection of this bony part is called the processus cochleariformis. Then below there is a thin temporal bone. This is the temporal bone, part of the temporal bone. Then medially there you can see the carotid canal with this internal carotid artery, and there is plexus of nerves over there. This forms the medial relation. Here this forms the superior relation, tensor tympani and this bony projection. Then here the spin plate of bone, here this forms the inferior relation. Then laterally we'll get the tegmen tympani. Then coming to the relations of this cartilaginous part, here this is the mandible, this is the posterior view, this is the coronal section. Then this here you can see this is the auditory tube, cartilaginous part of the auditory tube. This is the posterior nasal aperture or choane there, posterior nasal aperture. This is the cartilaginous part of the auditory tube. So anterolateral relation of this cartilaginous part, anterolateral, this is the posterior view, will get the spine of the sphenoid. See, this is the spine of the sphenoid. This is the spine of the sphenoid. Here you can see there is a mandibular nerve and its branches there. This is the mandibular nerve, the branch of the trigeminal nerve. There you can see one ganglia there, parasympathetic ganglia. This is the otic ganglia. And also we'll get the tensor veli palatine muscle. Here you can see this is this muscle is the tensor veli palatine. So this forms the anterolateral relations. Here this is the posterior view of the pharynx. This is the auditory tube. Then in this posteromedially there you can see the levator veli palatine. See, this muscle is the levator veli palatine. This forms the posteromedial relation, posterior and medial. Then above here we'll get the sulcus tubae, that is the groove, superior relation. Then below or the inferior, here we'll get the superior constrictor muscle. This muscle is the superior constrictor, this one. So this forms the relations of this cartilaginous part. Then coming to the muscles attached to this auditory tube, here this is the middle ear, this is the anterior wall, this is the bony part, this is the cartilaginous part. Through this medial lamina here, The muscles attached are, there is a levator velae palatine, there is tensor tympani, then this is the salpingopharyngeus. To the lateral laminae, to the fibrous part, there is the tensor velae palatine. Okay. So this tensor tympani, which is muscle attached to this middle ear, you can see it shows the middle ear. Levator velae palatine and this tensor velae palatine are the muscles of the soft palate. Salpingopharyngeus is the muscles of the pharynx. Okay. So this function of this auditory tube, that is, which maintains an equilibrium of air pressure on each side of this tympanic membrane. Okay. So at rest the tube is closed. During swallowing, yawning and sneezing, it is reflexly opens. Okay. So here the tube is opened actively by the contraction of the tensor velae palatine muscle. Here this tensor velae palatine muscle contracts, and which helps to open this tube. So this tensor velae palatine is also called the dilator tubae. It's also called the dilator tubae. Then that's about parts and relations and the mechanism of opening. Then coming to this blood supply, here the arteries supplying are, there is the ascending pharyngeal artery here. This ascending pharyngeal artery is a branch of this external carotid artery and branches from the middle meningeal artery. Middle meningeal artery is a branch of this maxillary artery, that is from this external carotid artery. Then the venous drainage into this pharyngeal and pterygoid venous plexus. Lymphatic drainage to the retropharyngeal nodes. Okay. Then lining epithelium. So this inner of this bony part and the cartilaginous part are lined by mucosa. So this cartilaginous part here is lined by pseudostratified ciliated columnar epithelium with numerous mucous glands, and the bony part is lined by here, that is of cuboidal epithelium, simple cuboidal epithelium. Then this nerve supply here. So the nerve supply, this is through the glossopharyngeal nerve. Nerve supply to the glossopharyngeal nerve, that is the 9th cranial nerve, through tympanic plexus. Then only the pharyngeal part is supplied by pterygopalatine ganglion, that is the pharyngeal branches from the pterygopalatine ganglion. Okay. Then here coming the length difference in the directions in children and this adult. Here in children the tube is wider and is more horizontal. See here the tube is more horizontal. Then in adults the tube is obliquely, here it is oblique, and its length is 36 millimeter. Here in children it is of 80 millimeter only, and it's wider and it is more horizontal. That is the reason why these ear infections are more common in children. That means this auditory tube, which act as a channel of infections from this nasopharynx to the middle ear. Okay. Moreover, here this auditory tube gets blocked due to the inflammation of the tubal tonsil. This is the lymph tissue. There again the tubal elevation, the part behind the auditory opening. There you can see an elevated area, that is the tubal elevation. There you can see this tubal tonsil. Okay. So if it gets inflamed, which produces disturbance in hearing due to the retraction of this tympanic membrane. Okay. That's all. Here we complete the auditory tube. Hope you understood. Thank you.